Industrial actions by health workers is becoming a ritual in Nigeria. Health workers goes on strike without minding the implications of their actions on the poor masses on the hospital bed. Hello and welcome to Health Business. My name is Oluwatoyin Kolawole, and on the program this morning, we'll be taking a look at the implications of health workers strike in Nigeria. Stay tuned.
Veterinarians in Nigeria have called on the federal government to make laws restricting cattle rearing to ranching in order to ensure national security as well as disease-free and more productive livestock. This was the thrust of deliberations at an event organized by the Nigerian Veterinary Medical Association in Lagos while commemorating the World Veterinary Day.
For us in the veterinary community, all we are asking for is that we should switch to ranching. And when I say ranching, we should stop the old way of rearing these animals. That is to say, moving from one pastoral land to another. And then, confine these animals to a point and then, conduct what we call intensive care management, feeding them, making sure water is available for them at libitum all the time. For us, we believe that that would, in no small way, improve the proficiency and the productivity of these animals. Because, like I say, it's only a madman that keeps doing something the same way and expect different results. We need to evolve, and it's obvious that we can see now that this method is not even supporting national security.
For me, I don't even have to think about it. Ranching is the answer, because when you ranch your animals, you're able to monitor their health progress, you're able to monitor their production progress, you're able to monitor the disease pattern even within the herd. And in a ranching situation, the animals are fed well because the food will be brought to them. It's not as if they are scattering and scavenging for food. Health will be monitored properly, and then it will result in the production of animals that are very, very fit for consumption. And then they will produce more because they waste a lot of energy. Walking about is a lot of kinetics. They waste a lot of energy, but here they are able to use the energy for production. And let me tell you something, if they don't have to move from one place to the other, scavenging for food, trudging on people's farm and destroying people's means of livelihood, because it's like we are trying to produce beef cattle and then we are destroying the arable crops. I don't know where that is practiced. So it is better that they are ranched somewhere, food is provided, medicals are provided, and then we have increased production. And it's going to be able to feed, we will feed ourselves. And there won't be the fighting and the needless killings that we're witnessing today.
With the theme of this year's World Veterinary Day as the role of the veterinary profession in sustainable development to improve livelihoods, food security, and safety, it is important to ensure all these are put in place. Workers' strikes involve the collective withholding of labor services by a group of workers for the purpose of extracting certain concessions or benefits, and are usually intended for the economic benefits of the workers. In Nigeria, the law allows all workers to form or join unions with the exception of members of the armed services, the police force, firefighters, central bank employees, and customs. The first nationwide strike by the organized workforce in Nigeria was on 21st June 1945 by about 150,000 clerical and non-clerical workers in the Nigerian civil service, demanding better wages in response to the rising cost of living brought about by the Second World War. The Nigerian health system has experienced more than 8 different strikes involving doctors, nurses, and allied healthcare workers. These strikes have negatively impacted on the healthcare system, leading to several avoidable deaths, complications, and outgoing medical tourism as the world seeks health services abroad. The impact of these strikes is worst when they occur at periods of national health emergencies such as the Ebola disease outbreak, Lassa fever, or cholera outbreaks, or even man-made emergencies like Boko Haram suicide bombings with mass casualties. Health Business went to town and asked if it's right for health workers to embark on industrial action regardless of their demands from government.
No, it is not very good for health workers to go on strike because many things will happen. People will lose life and all this, so it's not good for them to go on strike. Anything they are asking for, the government should answer them.
It's not necessary because they are managing human life. So it's very dangerous for them to go on strike. If anybody for who would be a person, it's very not conducive for them to go strike. But government is supposed to know their demands and meet up. They are very important for the society.
It's not good. It's not good. They are supposed to consider woman being. Woman being, if somebody is sick, they need care for the person. The person can die. You know, they need to sacrifice. You put a little sacrifice. If there's negotiation with the government and a doctor or nursing, what they need to do is to have patience because of people dying. If because of their own interest, they don't care people dying. What's the benefit of helping in Nigeria? They need to help. They have to contribute their own quota for the head. Not money, this today, tomorrow, striking is wrong. I don't support it.
They can pay them if they hold their money. They will tell them people are dying. If the person reaches hospital now, they are dying like a fowl, and it's no good for country.
The government doesn't pay attention to its people, and then if all is right, the doctor shouldn't be on strike. So there's probably something wrong. It's of course it's not right. Strike is not a normal. It's not something you find in a normal condition. But when there's a lack in an office, then that strike is the only thing that works in Nigeria for now. So they are only on strike because some of their demands are not met, and the government should just meet their demands. And if they do, well, we don't hope to have that. If they meet them, I don't think there's any reason to be on strike if they don't have a demand. So the government should just meet their demands.
Olumide Akintayo is the immediate past president of the Pharmaceutical Society of Nigeria and a supporter of the ongoing industrial action by the joint health workers. In an interview with Health Business, Olumide noted that health workers in Nigeria embark on industrial action because of factors such as career stagnation, discriminatory policies, and demoralization from working in systems with poor infrastructure.
There is a constitutional proviso in Nigeria in sections 42A and B. It prohibits discrimination to any citizen of Nigeria on the basis of his sexual, socio-cultural, religious affiliations. I let me there had his professional affiliations. The major reason all of us work because we go to the same market, and so we all seek reward for labor. If I am a pharmacist of very close to 35 years standing, when I graduated from the university, the salaries of pharmacists and doctors in this country was same, more or less. We both entered the public service for internship and housemanship, respectively, on grade level 8. We won grade level 8-2. They won grade level 8-3. The one-step difference was as a result of the one-year differential in the duration of training at that time. In arithmetical terms, that one-step difference amounted to 7 naira or 84 naira per annum. After youth service, we moved to grade level 9-2, they moved to 9-3. The difference in our take-home was 15 naira. And then Olikoye Kuti came up with this medical salary scale. And since then, Nigeria has not known peace in labor circles, that is, because the advent of discriminatory salary wages is what actually disrupted the equilibrium of services in Nigeria's public sector, in the Nigerian public sector. The MSS scale ensured that medical doctors earned almost 200% over what their contemporaries were earning. And so, of course, there were agitations everywhere. To placate other health workers, government came up with the health salary scale. By 2009, when late Umaru Yar'Adua was president, the Federal Ministry of Health, under the leadership of Professor Chukwu, came up with this Corners and Commerce scale. And the agreement was that at all times there would be parity in those two salary scales. In other words, if you adjust one salary scale by 5% or 20%, there will be corresponding adjustments in the other one to maintain equity.
He further explained that the failure of government to act ethically by keeping its own part of the September 2017 agreement with health workers will continue to cause crisis in the health sector.
This administration entered into some terms of agreement, settlement agreement with health workers on September 30. Specifically, the agreements were in 5 areas, and the most striking ones were that the federal government was going to adjust the Corners scale, which is a scale employed in the payment mode of health workers in Nigeria, will be adjusted like was done with CONMED's scale, which is used for doctors. And that is to ensure parity, because in 2009, when those salary scales were introduced, the fundamentals of coming up with those scales was grounded in the reality that there would always be parity in those salary scales to ensure it was not unfavorably distorted in favor of any group. Now, having adjusted the common scale twice in the last 3 years, first in January 2014 and again in September 2017 in favor of doctors, on each occasion the circular that legitimized those adjustments were issued within 2 weeks. It was thus fair that government reciprocated that noble gesture with clamoring health professionals and workers in the totality.
Nigeria are, however, calling on the federal government to accede to the demands of the health workers so as to avert unnecessary losses of lives of patients in the various government hospital beds.
On Mother and Child this week, Professor Bamigboye will be educating mothers on what they need to do immediately after childbirth. Stay tuned.
How soon can a woman who just delivered a baby engage in sexual intercourse?
Well, many women ask this question across board, and many more hesitate to ask because of our orientation in Africa. But it's a question that lingers on, because many will say that their mother told them not to have intercourse while they are breastfeeding until they are ready to have another child. That is the extreme. Some will say, I was advised not to have intercourse because of the possibility of infection. But to answer it straight, when a woman gives birth, the uterus or the womb gives out the lochia. The lochia are the discharges. The lochia could be red, it changes to yellow, then it goes into white or colorless at the end. So when we have lochia rubra, which is a red one, it means the blood is still fresh, it's not advisable to have intercourse. But by the time you are going to colorless or white or whitish discharge, which is normal, then the woman is apparently ready, which is usually about 6 weeks after the child is born. So I will say, a woman can hang on until after 6 weeks. After that, you're free to do to copulate.
Is it true that sexual urge in women reduces after childbirth?
Well, if you look at that question, after a childbirth, that period of life in a woman is filled with anxiety. It's filled with it's an extra effort to look after the child at night. The first 6 weeks, the child will cry, will breastfeed, and so on and so forth. And I can tell you that the anxiety, the stress on the woman will not encourage her or will not make her have anything to think about sex at that point in time. But after 6 weeks, the physiological aspect of the body is coming into normality, and then a woman can start having sex. And the reduction in urge is not true, not at all. It is not true at all. It is only when there are issues, there are pathological issues, the woman is sick, or the breast is infected, or there is no support by the partners or at home, that is when they will continue to have no interest in sex. Otherwise, the urge is the same.
Some men complain about laxity in women's private parts after childbirth, and this puts men off. How true is it, and what can be done?
Right, men complain about all sorts of things. However, many of them are not true. Some of them are true. But if you look at it holistically, a woman who has just given birth needs to do pelvic exercises to strengthen the perineum tissue. Now, when the pelvic exercise is done, then the laxity, the so-called laxity, is not there. But in the extreme of cases, for example, when the head of the baby is quite big and it has to pass through the vagina, some cuts were made, episiotomy, vaginal cuts, which are repaired, but not properly repaired, then there could be laxity. Also, if there is no repair at all, if there is a tear of the muscles on the vagina, then you can have laxity. So those are things which could be repaired, physically by some kind of surgery. We do have, colporrhaphies, we call it, which is repair of the vagina after a laxity event. That is done, but not immediately. We allow all the tissues to heal, then we bring them back. Within 3 months, we repair it. But on the long run, most women really do not have laxity. It's just a psychological thinking of the man that makes them think that their vagina, is lax.
Next on the lineup is regenerative medicine with Dr. David Ikudaisi.
Hello, I'm Dr. David Ikudaise. I'm going to be talking about regenerative medicine this week. I know some of you have been following this program, and for those that are new to this, regenerative medicine is that area of medicine that aims to restore normal function of damaged tissues in the body that could have been caused by age, disease, or congenital problems. Regenerative medicine involves platelet-rich plasma therapy, which is using the patient's own blood. It also involves stem cell therapy, of which there are 3 types. The embryonic, that's controversial because of involvement with potential human beings, the embryos. And the second type of stem cell is induced pluripotent. That is when you take this skin or fibroblast tissues to the lab, and you can grow maybe nose from that and so on. That also has no current clinical applications. The third one, which has been proven to be safe, which is now readily available in most countries, is adult stem cell therapy. Adult stem cell therapy is when you take a stem cell, either in form of fat, or from the fat, or from bone marrow, or maybe even umbilical cord blood, and you use that to accelerate regeneration or repair in any damaged tissue of the body. Regenerative medicine is rapidly gaining grounds as an alternative. In orthodox medicine, when we've given up hope, or even the patients have been told that there's no other way around, but regenerative medicine steps in to offer hope in certain areas, not in all areas. For example, the difficult areas that have not been able to be addressed by regenerative medicine are areas like, let's say, breast cancer. A lot of research is still going on, so readily there's no available treatments with regenerative medicine. All I'm trying to say is that regenerative medicine or adult stem cell therapy does not cure cancer. Although research have been done, and cases are showing that it may shrink prostate cancer, brain tumor. There was a study published also on NIH, that's US Library of Medicine, that it reduces inflammation in a patient with lung cancer. But unfortunately, we still don't have cure for cancer, just to be clear. That being said, regenerative medicine can help patients with seizure, patients with cerebral palsy, patients with multiple sclerosis. All these neurological conditions that I'm mentioning are conditions that we believe that there's no cure for, but regenerative medicine is telling us otherwise, that these conditions can be reversed, their symptoms can be reversed, and patients can improve. Maybe not 100% cure, but at least regenerative medicine is able to give hope when we've already lost hope. There are also other common conditions that I might have mentioned of in my previous explanation during the previous episodes, like diabetics, that's a common condition, arthritis, chronic kidney disease, lupus, that is the autoimmune conditions. It can also help with male and female sexual dysfunction. It can help with, you can use it in a cosmetic way as well for facial rejuvenation, hair loss. So all these areas of applications have been proven also to be safe. So if you are new to regenerative medicine, or the term regenerative medicine, I just want you to understand the basic things, that it is mainly if autologous from your own body giving back to you, and the risk of rejection is 0. But there's allogenic part of it, which is when you get the donation of the stem cells from someone else. That there has to be a proper cross-matching in order to make sure that it is safe. So that still carries a little risk. And for those of you watching this, if you that you or relative may have heart disease, like maybe heart attack or congestive heart failure. Regenerative medicine in form of adult stem cell therapy has also been proven to improve the functionality of the heart. So it's not like a death sentence if you have been given that kind of diagnosis of congestive heart failure. Thanks to regenerative medicine, there's still hope. I hope I've been able to explain during this week episode how regenerative medicine can help different medical conditions. And there are so many that I can't mention all. It's just that it doesn't have there's no cure with it for HIV or hepatitis. Let me be very clear about that. Otherwise, if there is degeneration, regenerative medicine may help to regenerate the body. Thank you for watching, and I'm looking forward to continue this education during our next week's episode. Till then, have a nice weekend.
We've come to the end of today's package of Health Business. For further questions, advert and sponsorship, please call the numbers showing on your screen. Remember, living healthy is a serious business. My name is Oluwatoyin Kolawole and the program is Health Business. Join me again next week for a fresh package. Bye for now.
Thank you.